Hi, I'm Vineet Mahajan from Stanford University, where I'm a professor and retina specialist. I had a chance to just speak about Nanoscope's optogenetic therapy trial called REMAIN, where they're treating patients with retinitis pigmentosa with a really new, interesting optogenetic therapy. What they've done is created a synthetic protein, probably one of the most synthetic proteins ever put into a human, to make retinal cells light sensitive again. So the patients in this trial have retinitis pigmentosa from various causes, but they've lost their photoreceptors. So they have some of the worst vision that we've ever had in a trial. The best patient's vision was 21,700. It's off a normal chart. And all the other patients' vision was much worse in the light perception to hand motion range. And what they did was in a single in-clinic intravitreal gene therapy, deliver this protein that would make bipolar cells light sensitive. And what they did was actually restore vision. The primary endpoint, which they reached, was a 3-line letter gain. So these are patients, very severe vision loss, now able to see 3 lines better. And we've studied them now for 3 years, where they have sustained vision improvement. Now, one of the important things with any gene therapy, and especially when you're putting a synthetic protein into a human, is there inflammation? Is there an inflammatory response? These patients got some oral steroid around the time of the trial. If they had some mild inflammation, they were treated with steroid eye drops. But overall, there were no serious adverse events. The patients tolerated the therapy really well. And even though the primary endpoints were at 1 year, we've now been able to follow these patients for 3 years. So this is really amazing. No adverse events and improved vision. And what this tells us is that we can now start thinking about other diseases where there's significant photoreceptor loss and you have patients in this hand motions light perception stage, things like Stargardt disease and very advanced geographic atrophy. It's very significant because it's the first time that we've put such a synthetic protein into basically a blind patient and restored vision. These are normally patients that are excluded from other gene therapy trials, normally not even the patients that we really want to see in clinic because they're blind. What's really important is compared to other gene therapies, this was gene agnostic. So it didn't matter what gene you had that was causing the retinitis pigmentosa, just that you had very advanced disease.